Hello, I'm Dr. Oleksii Kalmykov. Today we will talk about 3 simple breathing techniques that can help many people over 60 calm the nervous system and sometimes lower blood pressure a little in the short term. If your blood pressure is around 180 over 120 or higher, and you have symptoms such as chest pain, shortness of breath, weakness or numbness on one side, trouble speaking, or sudden vision changes, treat that as an emergency and seek urgent medical help right away. Do not try breathing exercises as a substitute for emergency care. Now, for everyone else, breathing is not magic and it does not replace medication, but it can be a useful tool for stress-related spikes and white coat blood pressure. What does the evidence say in plain language? Breathing exercises across randomized trials tend to reduce systolic blood pressure by single digits on average, roughly several millimeters of mercury, while results vary by person, technique, and study quality. That may sound small, but small, sustained reductions can matter, especially when combined with the proven basics: medication when indicated, salt reduction, weight management, physical activity, and sleep. So let's focus on what is safe, practical, and realistic. Before you start, sit in a stable chair with back support, feet flat. If you feel dizzy at any point, stop and breathe normally. If you have COPD or asthma, keep every breath comfortable, no breath holding. If you are prone to falls, do this seated only. Important. Technique 1. Long exhale breathing for quick calm. This is my safest in-the-moment option for older adults because it does not require breath holding. Inhale gently through the nose for a slow count of 4. Exhale slowly through the mouth for a slow count of 6. If you can do 8 comfortably, fine, but comfort comes first. Do 6 to 10 cycles. Why it may help? A slightly longer exhale tends to shift the autonomic balance toward relaxation. That can reduce stress-driven blood pressure elevation. But you may see a small change or none. No guarantees. Important. Technique 2. Paced breathing at about 5 to 6 breaths per minute. This is the best studied style overall. Slow, steady breathing, often used in device-guided or app-guided protocols. Some studies report that a 15-minute guided session can reduce blood pressure in the short term, especially when the starting pressure is higher, though many studies rely on self-measurement and not all high-quality comparisons show benefit beyond relaxing music or quiet sitting. So we present it correctly. It is a structured way to relax, and it may help BP modestly. Slowly, inhale through the nose for 5 seconds. Exhale through the nose for 5 seconds. That is 6 breaths per minute. If 5 seconds feels too long, start with 4 and 4. Keep it smooth, no straining. Do 10 minutes at first. Build to 15 minutes if comfortable. Technique 3. Alternate nostril breathing. Alternate nostril breathing, sometimes called nadi shodhana, has RCTs suggesting reductions in systolic and diastolic blood pressure compared with control conditions, but results are heterogeneous and study quality varies. So I describe it as optional, a calming practice that may help some people. How to do it safely? Sit comfortably. Close the right nostril gently with a finger. Inhale through the left. Switch. Close the left nostril. Exhale through the right. Inhale through the right. Switch. Exhale through the left. That's 1 cycle. Do 5 to 10 cycles slowly. Important, do not hold your breath. If you have arthritis and cannot do the hand positions, skip this technique and use paced breathing instead. A simple daily plan. Morning or afternoon, 10 minutes of paced breathing, technique 2. As needed for stress, 2 to 3 minutes of long exhale breathing, technique 1. Optional evening wind down, 5 minutes of alternate nostril breathing, technique 3, or simply repeat technique 2. If you are on blood pressure medication, keep taking it unless your prescribing clinician changes it. Breathing is an add-on tool. It is not a replacement. How to check whether it helps you without obsessing. If you want to test the immediate effect responsibly, sit quietly for 5 minutes, measure BP once, do 10 minutes of paced breathing, wait 1 to 2 minutes, measure again, log the numbers and the time. If you notice repeated readings that are very low for you, or you feel lightheaded, contact your clinician. Medication doses sometimes need adjustment, but that must be supervised. Stop and seek urgent help if you develop chest pain, severe shortness of breath, fainting, new weakness, numbness, confusion, trouble speaking, or vision changes. Closing. Breathing exercises can be a practical way to reduce stress and may modestly lower blood pressure for some people. The best evidence supports small average improvements with variability, and that is still worth using as part of a broader plan. If you want one place to start, sit down, relax your shoulders, and do 10 minutes of 5 seconds in, 5 seconds out breathing today. Take care of yourself.